A remarkable new technology from GE Healthcare is bringing the benefits of deep learning to MRI. Recon DL fundamentally shifts the balance between image quality and scan time. This has the potential to completely change the way we think about MRI. This is unmissable.
These images popped up on this screen. Literally couldn't believe it. We would have thought these images were impossible in any kind of standard scan time.
With our Recon DL, you can reduce the scan time at least 50% for 2D sequences. And that is really important in musculoskeletal imaging and spinal imaging.
So when I saw the images, of course, the first point was that it was going very fast. For example, for a spine acquisition, in less than 2 minutes to have incredible images.
It basically, the increase in image quality and resolution, increased signal-to-noise ratio in almost every single exam. And at the same time, most exams were done in 25 to 30% less time.
We can reduce the number of excitations by nearly half without losing image quality. Arguably, in many cases, it's actually improving quality as well.
The image quality, the scan times, again, probably the biggest revolution we've seen in imaging in the MR field in a long time. And I've been doing this a long time. So anytime somebody has asked us about our experience, we say one thing: get it now. Just don't hesitate, just get it now.
When you're looking at patient feedback, you're basically looking for negative feedback. And so when you get a patient off of the scanner, it's been a 45-minute scan, they tend to complain a lot. You know, that took forever, it was so noisy, it was so uncomfortable. The beauty of being able to do patients quickly is they're in and out before they really get a chance to experience a lot of discomfort. And so it's like a happy camper syndrome. You know, they come out, they're done, okay, that wasn't so bad. Grumpy old men come in. I mean, these guys that come in for their prostates, they are not happy about it. They're there because their wife made them, their doctor made them. It wasn't because they wanted to be there. And if I can get a grumpy old man in and out in 15 minutes, they are not grumpy, which is a miracle.
First, I would like to say about patients' experience. We have some of the patients which went through perform an MR, and some of them had already been through this kind of examinations, and they exit the room saying if there was something wrong with their exams because it ended up too soon. So one of them thought that the scanner was broken because it took only 5 minutes to perform a knee examination between getting down on the table and started scanning.
We do a lot of musculoskeletal imaging, and there the scan times can be relatively lengthy when you're trying to get very high SNR with small fields of view and very high resolution. And for that area, I've seen a pretty significant impact. We're really able to have shorter scan slots and improve the throughput. I think for patients, they don't necessarily know that this is features being turned on or off, right? But they wind up just seeing that their appointment has gone quicker. For a lot of children, we're just able to get the scans done before they've reached the limit of cooperation that they're gonna give us.
It's gonna make a big difference that we can get excellent quality studies in shorter time when it's appropriate. And that's going to be a big drive of the hospitals to get through the backlog which is built up. So yes, absolutely. In the past, if we'd gone to the number of excitations that we're using now with DL Recon, it would have been non-diagnostic. There's no point in doing that. So yes, absolutely, it already made a big difference.
So we're all in a busy imaging market, and anywhere from 20 to 30% of our cases are add-ons. Everybody else is faced with that problem. Where are you gonna put these people? You don't have slots? Here, you now have the opportunity to do cases in less than 15 minutes with exquisite anatomic detail. Thinking, for example, seeing the superficial layers of cartilage, subtle meniscal flaps, small areas of labral tears that normally would take us anywhere from 30 to 40 minutes to attain. The shorter the scan, the happier the patient, the more compliance you get, the less motion, the better the scan quality. The faster we can do it, the better.